So friends, today we're talking about monitoring and evaluation. This is step 8 of the process. And we're going to talk about the components of an evaluation plan. And these are essential for understanding how to measure the effectiveness and the impact of any program or any campaign. So the first thing you want to look at is the purpose. So the purpose is the foundation of any evaluation plan. You want to ask yourself, why am I conducting this evaluation? So without a clear purpose, your data collection efforts might not align with your goals. So for example, let's say you're running a campaign to promote recycling. Your purpose would be to measure change in recycling habit within the community. And so the clarity ensures that every step of your evaluation is intentional and aligned with your overall goal and objective. Number 2, you want to look at the results to be measured. So once you have a clear purpose, the next step is to identify specific results that you want to measure. So if you're looking for short-term outputs, things like attendance of an event, or long-term outcomes like behavioral change, you have to figure out how you are going to be measuring that. So let's say you're running a public health campaign to encourage vaccinations. You're going to measure the number of people vaccinated, so the output is important. But understanding changes in attitude towards vaccine, that is an outcome, might be even more insightful than it would be if you were just counting the number of people, if you are looking to see the change in their attitude. Cool? Make sense? All right. So these practical considerations are often overlooked, but they're crucial in terms of in terms of methods, timing, and budget. So what method will you use to gather your data as you're doing your evaluation process? Your surveys, focus groups, observational studies, or interviews. Timing is also key, so you will collect data throughout the program or only at the end. Lastly, budget, and that is the budget constraints that can shape what is feasible and what is possible. So the idea here, when you're talking about methods, timing, and budget, and actually the entire portion of the evaluation plan, you should have the evaluation plan before you start the program, okay? Because if you don't know what you're looking for. You don't know what the key performance indicators are. So the things that indicate if you're actually performing well or not performing well. So this needs to happen before. Sounds good? Awesome. The second thing that we're looking at today, or our second slide, is the step 8, it's creating a structured plan for the evaluation. And you're looking first and foremost is developing an evaluation plan is about preparing for success, and it allows you to define what success looks like and provide a roadmap to determine whether you'll be able to achieve it or not, or how you'd be able to achieve it. So for example, if your goal is to improve pedestrian safety, your plan should outline how you will measure reduction in pedestrian accidents and change in the community as well. The difference is, what's the difference between monitoring and evaluation, where you're looking at, they are complementary, but they are distinct, different process. So monitoring is ongoing and tracks progress during the program. So like keeping a pulse on the program activities to ensure that they are on track. Evaluation, on the other hand, takes a step back to assess the overall impact after implementation. So for example, while monitoring might track how many people attend the workshop, evaluation would assess whether the workshop led to measurable behavioral change, okay? So the difference, monitoring, you're doing it throughout the process. Evaluation is at the end. So imagine you're leading a company to reduce weight. Your monitoring effort might involve tracking how many educational workshops were conducted. That would be monitoring. The evaluation would look at whether the household reported a reduced food waste over time. So the purpose of conducting a measurement is critical. It shapes every aspect of the evaluation, and without having this clear understanding of why you're measuring, your efforts might become unfocused, okay? But you want to stay on track. You want to stay focused, and you want to make sure that what you are doing, you're actually doing for a purpose and not deviate off of it. It's kind of like when I sidetrack into conversations and in your mind, you're like, end the class already. Yeah, this is the same thing, okay? You want to come back to it and you want to stay focused. So potential reasons for measurements, these reasons can vary greatly. And so you want to look at maybe fulfilling grant requirements is one common reason. So if you are a nonprofit, a lot of times you require grants, and that grant means that you get money from the government and you have to prove to the government or the entity that what you're doing is actually working. And so you have to go through an evaluation process. So that is, so the funders might want to see that. Another reason might be internal, so learning from your experience to enhance future initiatives. So for example, if you ran a campaign to promote bike sharing, you might measure how many people sign up and analyze why some people did not sign up, okay? So an example of that is if you have a nonprofit that provides meals to underserved communities, if the purpose of measurement is to meet a grant requirement, they might focus on the number of meals delivered. However, if the goal is to improve the program, they might measure customer satisfaction and the nutritional value of the meal. Okay, so not just the fact that they provided a meal, but the fact of how healthy or how good and filling it was. Make sense? So again, we're continuing on. Support, so to get support for continued funding is another reason. And for example, if you're running a pedestrian safety initiative, you can show reduction in accidents. And so funders might be more likely to give you that grant again and give you more money. It might be used to reduce for resource allocation. So measurement helps you decide where to focus your effort. So for example, if your data shows that certain neighborhoods are benefiting more than others from your program, you can allocate more resources to the underserved areas. Course correction is another one. And so data isn't just about looking back, it's actually about looking forward and making a predictive forecast as what is going to happen. So it allows you to identify what's not working and make adjustments. So for example, if your campaign promotes, if your campaign to promote pedestrian flags isn't reducing jaywalking, you might need to reassess your messaging or your placements. Okay, make sense? All right. So what will you measure? And this is an overview of the modified logic model. A logic model is a framework that outlines the input, output, and outcomes of a program. It's like a roadmap that shows the relationship between what you do and what you achieve. So for instance, if you're running a literacy program, the input might include funding and staff. The output might be the number of workshops conducted, and the outcome might be improved literacy rates. And reporting can be challenging, especially when we are dealing with complex outcomes. So for example, if your goal is to improve mental health and community, how do you measure something that is as intangible as improving mental health? Well, we do that by creating surveys or by creating interviews and focus groups that help us quantify something. Okay, so the idea is to take these abstract concepts and put them into SMART goals, right? Specific, measurable, attainable, achievable, all these things time bound. When you have these goals and you have key performance indicators, again, things that indicate that you're performing well through surveys, through interviews, or whatever, you can take something that is intangible and make it more tangible. A pre and post survey is probably a good idea generally. So let's discuss a little bit of input measures, and they are the foundation of any evaluation plan, and they measure the quality of the resources invested into a program or a campaign. So think of them as ingredients of a recipe that are essential for achieving the desired outcome. So when we talk about definition and simplicity, input measures are straightforward because they are the easiest quantities. They're what is actually coming in. So they're focusing on things that are tangible that go into the products. So things like financial investment is one of them. Personnel, material, these are all part of the input. Then you have the most common elements, and these measure often include time, money, and physical resources because this is the most common. So for example, let's say you're running a digital marketing campaign. The input measures could include the cost of ad placement, the number of people hired to run these or create the content, and the distribution, where it went, and the hours your team spent engaging with the community. That would be the most common element in that campaign. Beyond the obvious inputs, you have a few other things that are also accountable, also part of it. So accounts for contribution from stakeholders. So things like volunteer hours, donated materials, these are all also inputs. And why do we measure that input? Well, because they provide a baseline for assessing efficiency and effectiveness. So if you know how much you invested, you can later compare it to the output and the outcomes to determine whether your program delivered value or did it lose on its value. So for example, if you spend 10,000 people on a campaign but only reached 100 people, this can show inefficiencies in resource allocation. All right, we talked about the inputs. Now let's talk about the outputs, what goes out of this project. All right, definition and focus is probably the first thing, sorry. Thank you. All right, so outputs are all about activity, and so they measure what was produced or delivered, such as number of flyers distributed, social media posts created, or workshops that were held. So for example, in a public health campaign, output measures might include the number of brochures handed out or the number of people who attended an educational seminar. So what are the different types of outputs? We have two of them that we are going to look at. One, quantifiable materials and channels, and tracking reach and frequency. So when we talk about quantifiable or quantifying materials, it involves counting tangible items, such as the number of posters printed or emails sent. Reach and frequency, on the other hand, refers to how many people saw your message and how they were exposed to it. So let's say you have a billboard and that billboard reaches 10,000 drivers daily, while a digital ad campaign might have a frequency of 3 impressions per user, okay? So what are some practical applications into all of this? In a community event promoting energy conservation, output measures could include the numbers of attendees, the number of energy-saving kits distributed, and the media coverage generated. Those would be the output of your event. These provide a snapshot of the campaign's reach, scope, and they help you assess whether your activities carried out as planned. Okay, cool. That's the output. You have an input of people volunteering, you have an input of material, you have an input of money, you have an input of things that ads that were played, and an output of what was actually produced and did it reach what it's supposed to reach. So while outputs measures are useful, they don't always tell the whole story. So distributing 5,000 leaflets doesn't guarantee behavioral change. Outputs are necessary, but they are not sufficient. They must be paired with outcome measures to assess the true impact of your effort. And always remember, outputs are the bridge between inputs and outcomes. Okay, so you inputted something, you produced something, an output, and that output led to that outcome. Cool? Yeah? We're feeling okay? All right. Continuing on, we have media coverage is a powerful metric in any campaign. So it reflects how often and in what context your program is being promoted and mentioned in the media. Okay. So that would be, for example, your campaign to reduce water consumption is featured on a local news. That would be media coverage. A blog that posted it, whatever the case is, that would be media coverage. Impressions and cost per impression. These are metrics that are especially relevant in digital marketing, which is something that we are all accustomed to, and it's a big portion of marketing. And the total impressions measures how many times your content was displayed, while the cost of the impression helps you understand the financial efficiency of your effort. So for example, let's say you posted a campaign and there were 100,000 impressions for that campaign, and each of them costs 5 cents, then you know that you are comparing if that impression was worth it for you or not. Cost per click is a very important metric as well. So if you're running an online campaign, CPC tells you how much it costs to get one person to click on your ad. A low CPP generally indicates your messaging is resonating with your audience. Okay, it's those spots, the sponsored spot on Google, that's usually CPC. Yeah, so if someone is paying for those campaigns, they're showing up on top, and that's the reason why. Implementation of program elements refers to tracking the completion of the planned activities. So for example, if your program includes holding 10 workshops, publishing 20 blogs, and running a 6-month ad campaign, tracking the completion of these elements ensures that your program is on track. It also helps you identify any gaps or delays in your execution. And these are essential not just for understanding what's not working and but also for understanding what's not, for understanding what's working and what's not during the campaign. I feel like I'm running through this like I'm running a marathon. Feel free to stop me at any time. There are like 3 pages of notes that are missing. I don't know where they went. All right. So again, outcome measures, you're assessing customer responses to your outputs. So whatever it is that you outputted in as a result of your inputs, you want to be able to assess it, and that's the outcome. Okay? What happened as a result of your flyer being there? What happened as a result of your workshop? Did people feel more prepared? Are you following up in 6 months to see if they're still implementing your strategies? That is something that you'd have to decide in your evaluation plan. So as you're planning, you can say, okay, well, what actually happened? That would be the outcome. And am I going to study it just then, or am I going to look at it later on? So there are 2 different types that we're going to look at. The first is changes in behavior. Did the person's behavior change as a result of your campaign? So that would be the output. So if you want people to quit smoking, it would be a change in that behavior that they actually quit smoking. Or was there a change as a result of your output? Was there a change in behavior intent? So do they, because of your workshop, do they now intend to stop or quit smoking? Make sense? Cool? All right, more things that you're measuring or you're evaluating the changes in knowledge. Are people, as a result of your awareness campaigns, are they doing better? Do they know more? Does that change how they feel or how they believe or their attitudes about things? Okay. Do they walk in feeling a certain, let's talk about, for example, when you address marginalized groups and other people don't know that this is what they're struggling with. And they go to your seminar. Have they changed their beliefs and attitude about that particular group or that behavior? Okay. How are they responding to certain elements in the campaign? Are there certain parts that are resonating? And that is all part of the outcome. And then also you're measuring and you're looking for campaign awareness as well. Did this campaign do what it was supposed to do in terms of raising awareness? Continuing on with the same thing, we're looking at norm creation when we're measuring output measures as well. Is there a new norm created? That's something that you could measure. Customer satisfaction level. Are the people leaving happy? Are they not feeling happy? Would they come back to you? Partnership and contribution created as well. And you're looking for the policy change. Those are all things that you could, again, evaluate for. They're not things that you have to evaluate for every single time. They are things that you can make a part of your evaluation. Impact measure takes us into a realm of evaluating the ultimate effect of a program or a campaign. So these measures, they actually go beyond the immediate outputs and outcomes, delving into larger long-term changes that your initiatives are driving. So it's not just about this week or this month, it's actually a long-term thing. They are critical and very important, but they're also the toughest things to measure. How many of you have taken antibiotics before? Almost everybody in the class. You don't get through being a kid without taking antibiotics, right? How many times did you want to stop your antibiotics when you started to feel good, but your parents kept on saying you have to finish the entire dose? Yeah, okay, that's usually the case. Because if you stop midway through, that treatment it's not as effective, right? What happens is when people start to get better, they start dropping off and they start saying, oh, well, it's okay, I won't finish it. And it does not become a priority anymore. This is why impact measures are very hard to measure, because following up with people is a lot harder when there's a distance between the actual change that took place and the program that they went through and what happened in their life a year or 2 years from then. Make sense? Kind of the same way. You stop taking your medication because, well, I'm already feeling better. So you're distancing yourself from them. All right. So some of the problems is that there is a higher level of rigor because you're trying to establish causality. Did your campaign directly lead to the change you're observing? This involves complex methodology like randomized control trials or longitudinal studies, which can be time-consuming and expensive. They do this a lot in medication. Impact measure can also spark controversy, especially when the stakeholders have different views on what success looks like. There is a need to trust. So to measure impact effectively, you need reliable data and methodology. So if you're evaluating a program aimed at increasing literacy rates, you must trust that your testing instruments are accurately measuring literacy improvement and not other unrelated factors. There is a need to wait. And so impact often takes time to manifest. So for instance, if you're running a public health campaign to reduce smoking, the immediate output might be the number of people reached by your ad, and the outcome might include increased awareness and increased intent to quit, but the true impact is reduced smoking rates. So that might take years to actually materialize, and that might have other things that are influencing it. So that becomes harder for you to measure. It could be your campaign, it could be someone else's campaign, it could be life, it could be something that happened to that person that pushed them forward. There is a need to be rigorous. So because your impact campaigns are so consequential, the process must be rigorous. So this includes defining clear metrics, using appropriate research design, and analyzing data thoroughly. So for example, a program designed to improve community health might use pre and post intervention surveys. You also have the ROI, and that's something that you have to measure, and that would be your return on investment. And now this is a social campaign, so it's not necessarily, you're not necessarily looking for money return, you're looking for behavioral change, but nevertheless, there is a return on your investment because it translates your efforts into financial terms, and it shows the stakeholders the tangible benefits related relative to the cost. So for example, you are looking for accountability and sustainability. If you've invested $100,000 into a public health campaign, you have to demonstrate that, and you have demonstrated that it saves $500,000 in healthcare costs. You've clearly shown the value. So there's a lot, for example, a lot of companies now, or a lot of insurance companies now, that will provide meal prep for people. And part of it is that they've seen that food that is already prepared and it's already healthy, and if people stick with it, then their costs would actually be reduced. The insurance company's costs will actually be reduced. It looks like it's more upfront cost, but it saves a lot at the end. So they're more inclined to say, let me offer someone who has diabetes this meal prep plan so that I don't have to, which will cost me maybe $10,000 over these 10 years, versus if they enter into the hospital, it costs me $100,000. Does that make sense? Yeah? Carefully calculating your ROI involves two main components: the money spent and the behavior influence. So first, you have to tally up the cost associated with your program, including personnel, material, and overhead. Then you have to quantify the behavior influenced by your campaign. So for instance, if you're running an energy conservation program, behavior influence might include households switching to energy efficient applications. There are some challenges here in measuring the ROI. because it's a social campaign also. So how do you assign your dollar values to behaviors like increased physical activities or reduced stress level? That's something that's relatively challenging. One approach is to use proxy money. So for example, if you increase physical activity might translate to fewer doctor visits, which can be assigned a monetary value, which is kind of what we're saying when we talk about the food meal prep stuff. Yeah, you eating healthier might not be something that you can quantify, but investing into healthier eating might change how you are, or might translate later on into less visits to the doctor. So the comparison would be someone with diabetes typically visits the doctor, I don't know, 5 times a year and takes on these medications. Well, if you if the insurance pays for the food stuff, then maybe they will not visit the doctor as much, and you can compare the two. Are the people who are receiving the food visiting the doctor less because they're eating healthier and because the food is delivered to their house, or is there something else that's going on? Make sense? Yeah, and so that's how you would measure the return on the investment. So let's say you're running a campaign to promote hand washing in schools. You spend $10,000 on material and outreach. After the implementation, data shows that 20% reduction in less, 20% reduction in kids showing up to school or not showing up to school, so being absent due to illness. So by assigning a monetary value to reduced absences, so fewer loss of wages for parents, reduced strain on healthcare system, you can calculate a positive return on your investment. So the ROI is not just about numbers, it's about telling a compelling story of value by linking cost to a tangible benefit. And the last one we're going to take a look at today is, again, continuing on with the ROI. The cost of behavior influence, you could also measure that as an ROI metric. So this metric breaks down your investment into behavioral change. So for example, let's say you've spent $50,000 on a campaign to encourage recycling and influence 10,000 households to adopt a behavior. The cost per behavior influence would be $5, okay? So you're spending $50,000 to encourage recycling. You've talked to 10,000 households. That means that you've spent $5 per household. So that would be the cost per behavior influenced. It's kind of like the cost per click, except it's the cost per behavior. And that you can measure into ROI. You could also measure the benefit per behavior. So this flips the equation to focus on benefit generated by each behavioral change campaign. So for instance, if a household that starts recycling reduces waste management by $10 annually, and 10,000 households adopt that behavior, you've now reduced the cost by $100,000. And that is dividing this by the number of households gives you the household per benefit, which would be $10, okay? So again, run you through the numbers one more time. You have 10,000 households that were reached. Out of these 10,000 households, each household that used this, that you reached, reduced their waste by $10 annually, so a year. If you put all of these households together, you have $100,000 of reduction every year because of your campaign. That means it costs you, or the benefit per benefit behavior is out of that behavior, it's $10. So the number of households gives you the benefit per behavior of $10. Okay? And then the last one that we're going to look at is ROI. And this is return on investment again, and is essentially a ratio benefit to cost. So using the example that we just talked about, you have a program that costs $50,000 to generate $100,000 in benefits. The ROI would be 2 to 1. So meaning every dollar spent generates $2 in benefit. Okay? And so this is a powerful tool to demonstrate the value of your campaign and how it's actually working. So while, again, behavior change may not be tangible as other things, as selling a product or a service, there's still ways to evaluate it and ways to measure it. And these are the details that you have to pay attention to from the very beginning when you create your campaign, so that you can actually produce something that is good and that you can track. Because if it's not trackable, it's not replicable, and it didn't exist. Okay, cool. Sound good to everybody? Yes? All right, my beautiful people. That is it for this one. We'll continue on with this lecture on Thursday.